One of the most impressive features of the HPS simulator is the barcode reader. The barcode reader measures specifically the amount of medication that is injected into the patient, and the patient reacts appropriately to the medication that's been delivered. The medication is read through a syringe that's measured by a barcode, which I'm now going to demonstrate. As I demonstrate, appreciate that this is a volume reader in the barcode system that reads the amount of volume based on a drug concentration that goes into that patient. I'm going to say it one more time. This is important for you to remember for your customers. The syringe is filled with volume. The barcode measures the volume based on a drug concentration that is labeled on the outside of the medication, as it is here with a common paralytic medication. Also, really important that you talk to your customers about the real-life implications of a barcode reader. When we developed this product greater than 15 years ago, the barcode reader was something that was very new, exciting, and engaging for us. Within the last 5 to 8 years, with patient safety being at the forefront of everybody's minds, the barcode reader is actually being utilized in the real clinical environment. In other words, medication is actually being administered through a barcode before it goes into a real patient, so that nurses, physicians, and allied health practitioners can determine exactly how much medication went into that patient. You can have the discussion with your customers and clinical practitioners that you don't have to tell them, and they know just how many medical mistakes are made as a result of the wrong medication administered to the wrong patient in the wrong amount. It's pervasive worldwide. I'm going to demonstrate the pushing of a medication in the barcode reader now. Notice that I'm putting the barcode beside the device until the light turns green. I'm turning the stopcock towards the syringe, which means it's open, and I'm pushing the medication into the patient. When I'm finished, I'm going to turn the stopcock towards me, and as you can see in the Muse software, based on the doxycycline that was administered, the patient has received the medication, just over 2 milligrams of the medication. The syringe with the barcode attached to it and the barcode reader. This system does have to be primed and will always be primed when you have the opportunity to interact with it. Moving from the barcode reader, we can see because I gave a paralytic to the patient has stopped breathing. This is normal for the medication that was administered to the patient. What I'm going to do now is show you by taking a bag valve mask, which is a common clinical tool for anesthesiologists, and I'm going to ventilate the patient. By ensuring that I have an appropriate mask seal on the patient, I'm now going to deliver some breaths to the patient. There's a breath, and as I deliver this breath, notice how the chest is moving up and down based on the breath that I've delivered. You can also notice, both in the Muse software and on the actual patient clinic monitor, that the vital signs are changing appropriately. In other words, when the patient stops breathing, just like you and I, the oxygen saturation will go down, the heart rate will go up in compensation. The same thing happens here, as you can see, both in the Muse software and on the clinical monitor itself. Moving from the bag valve mask to the blood pressure. As I mentioned before, the simulator has physiologically appropriate cardiovascular and respiratory modeling. Talking about cardiovascular modeling, non-invasive blood pressure is a significant measurement of blood pressure in your patients. The Human Patient Simulator is the only simulator currently in the marketplace that has an accurate, physiologically correct, non-invasive blood pressure. In other words, this is the clinical monitor that you see in the real clinical environment. It's not simulated. This is a real blood pressure cuff. When a blood pressure is taken, this cuff will inflate and demonstrate and display on the real patient monitor exactly what that is. Okay, so when we start to administer the medication, it's important that the barcode is read from the infrared barcode reader, as you can see here. I turn the stopcock towards the syringe, administer the medication, in this case a powerful paralytic agent, doxycycline. Once the drug is administered, I'm going to turn the stopcock back towards me and remove the syringe. The common effects of administering a paralytic agent are the eyes closed, as you can see with the simulator, and the simulator is going to stop breathing. In much the same fashion a real patient would stop breathing. It becomes necessary, once that happens, to perform a clinical intervention. In this case, I'm taking a bag valve mask, which is a common anesthesia adjunct, and I'm going to perform some respiration, some ventilations. You can hear the alarm telling me that the patient has stopped breathing. And I'm going to go ahead and deliver some breaths. And you can see, as I deliver the breaths, that the chest is moving up and down. Now, this is a clinical intervention that would be necessary in the real environment. And because the HPS replicates exactly what real patients do, including the administration of drugs, it's necessary to do the same thing here. You also have the ability, with the HPS simulator, to remove a medication. As you can see in Muse, the software that drives the HPS simulator, simply by going into the medication tab, you can go into the monitor and remove the medication once the medication has been administered. This may be useful if, as an instructor, you administered the wrong medication on behalf of the student, or you didn't want the medication to be administered because it interfered with the outcome of the scenario or your learning objectives as set forth prior to becoming engaged with your students. Now, the simulator also has the ability to have a non-invasive blood pressure cuff both on the simulator attached to an actual clinical monitor. The actual clinical monitor has the ability to trend the non-invasive blood pressure cuff from a customized standpoint. In other words, you could create a time interval yourself, or there's a preset time interval. Again, this is a real blood pressure cuff. This is not a simulated blood pressure cuff. One of the unique and attractive features of the HPS, using real clinical equipment to deliver real clinical care. The simulator also has electrocardiogram leads that are built onto the simulator, meaning that you can use any clinical monitor that's widely used in the clinical environment attached to the HPS. That means that what the HPS is generating is an actual electrocardiogram signal that goes back to a clinical monitor. As you can see on the clinical monitor, the vital signs are reflective of the underlying patient condition. That's an actual clinical monitor that you're looking at that would be used in the real clinical environment. Part of that clinical monitoring can also be emergency cardiac care. Part of emergency cardiac care is the ability to defibrillate and transcutaneously pace a patient. Defibrillate is delivering energy directly to the simulator, which you would do on these two terminals right here, utilizing a real medical defibrillator. These defibrillators deliver energy in the form of joules. Now, the simulator can receive energy in the form of joules, both biphasic and monophasic, and it recognizes the energy that's been delivered to it. Aside from defibrillation, the simulator also has the ability to be paced. Pacing, transcutaneous pacing, is externally placing pads on those same terminals, delivering electric current in milliamps, that's milliamps, in order to augment a non-perfusing heart rate. Again, I want to make the point clear that you don't have to be a clinician, you don't have to be a physician, but you do need to sound intelligent when you have this conversation with the folks who are going to be interested in this particular simulator. One of the features of the HPS that is important to reinforce with your customers is the fact that you can take definitive airway control of the patient if you need to. This is clinically appropriate in the case of a patient who is not breathing adequately on their own, or the patient whose control of breathing I take away by giving them a neuromuscular blockade. For the sake of the demonstration, that's what we're going to do right now. As you can see in the Muse software, we're going to put 100% neuromuscular blockade onto the patient and take away his ability to breathe on his own. This works in the exact same fashion that administering a paralytic agent would work. When that happens, I recognize I need to take control of his breathing, and I'm going to place an endotracheal tube into his trachea. So I've taken the laryngoscope, performed laryngoscopy, and I'm going to place the endotracheal tube. I'm going to inflate the balloon and remove the stylet. Just like the clinical environment, I'm going to take my bag valve mask, and I am now going to take over ventilation of the patient. You can see as I squeeze the bag, his chest is moving up and down. That sound you hear is the PEEP that I have applied, or the positive end expiratory pressure, to the bag valve mask. I can adjust that. And the HPS is smart enough and sophisticated enough to recognize the amount of PEEP that I've put on the simulator. As you can see in the Muse software, the lungs are moving up and down as I squeeze the bag. I'm going to take the bag valve mask off the patient and extubate or remove the tube from the patient's trachea. And again, for the purposes of the demonstration, I'm now going to reverse the neuromuscular blockade that I had put on the patient, so the patient will begin to breathe again on his own. Again, important to recognize that taking control of the airway is a vital part, particularly for anesthesiologists who are a big target market for this simulator. We have appropriate airway. We have appropriate airway complications involving changing the look of the airway, or clinically speaking, we call it the mallampati of the airway. We can create a laryngospasm, and we can swell the tongue. These are common complications that any practitioner that deals with the airway may face, and we can replicate those problems right here on the simulator. In addition to what I've mentioned, there are also some physical features on the simulator that you need to be aware of so that you can explain them to your customers with authority. Those features relate to externally what's happening to the simulator and internally what's happening to the simulator. For example, the practitioner has the ability to perform accurate needle decompression at both of these sites. You will see a hole that's been pre-drilled in the chest that will allow for needle decompression. Why is this important? This is important because you can create what's called a tension pneumothorax. In other words, you can collapse one lung, the other lung, or both lungs at the same time. In this case, the practitioner would have to use an appropriately sized needle, a 14-gauge 2-inch needle, to relieve a collapsed lung, which is very clinically appropriate. To create the tension pneumothorax, there's a simple procedure within the Muse software that relates to all of the simulators. However, the important piece with the HPS is that the tension pneumothorax will resolve itself once the student performs the procedure correctly. In other words, the needle has to be placed to the appropriate depth, and the interpleural volume within the lung, or the piece of the lung that's collapsed, will reinflate on its own. As a refresher, remember, when you create a pneumothorax, the particular side of the chest will stop moving. Breath sounds will stop on that side until the student or practitioner has performed the appropriate action, in this case, placing a needle where it needs to go. Moving from there, The practitioner has the ability to place chest tubes bilaterally. That means they can be done on either side. You can see I'm pointing to a chest tube hole, which is where the chest tube needs to be placed. Unique to the HPS simulator is that both blood and air, or a combination of both of those things, can be evacuated from the chest using an appropriate chest tube and an appropriate chest drainage device. This is important because it's the only simulator in the marketplace right now that allows for this to happen from a measured response element. What I mean by that is the operator can control how much blood in milliliters gets released from the chest cavity. The operator can control how much air gets released from the chest cavity as well. These are common clinical conditions that face somebody who's had a traumatic chest injury, whether it is a crushed side of a chest, a pneumothorax, or a hemothorax, or blood in the chest. A chest tube is placed to evacuate air and blood. Titling is something that the HPS is capable of doing in a chest tube drainage collection system. And again, the HPS is the only simulator on the market that allows for this to happen. This is a great way for your faculty, your customers, to evaluate their students on whether or not they know what they're looking at when they look at a chest drainage collection system. There's strong evidence to suggest that it's a difficult concept to teach didactically. Doing it with a simulator, with an actual chest tube collection device, is far and away the most appropriate way to teach your students this procedure. Moving from the chest tubes, you'll see a hole in the middle of the chest, and this hole relates to pericardiocentesis. Pericardiocentesis is removing blood from the sac that surrounds the heart. Okay, you have the ability to utilize an appropriate 6-inch spinal needle to go in on this simulator and perform an appropriate pericardiocentesis. There's a small reservoir in the simulator that allows for the withdrawal of blood if the procedure is performed correctly. Another unique and important feature of the HPS is the thumb twitch mechanism. Now, when anesthesiologists deliver paralytic agents to patients, it's important to recognize when that agent starts to wear off and when the patient starts to regain consciousness. One of the clinically evident ways of determining what that is known as the thumb twitch. In other words, an anesthesiologist can use a device known as a train of fours that sends a little electric current into the wrist of a real patient to determine what their level of motor response is. The same thing can be simulated using the HPS. You'll note that there's 2 holes here. Underneath those 2 holes are 2 terminals. Those terminals can utilize the same train of 4 machine that anesthesiologists use in clinical practice. This is also directly related to the amount of anesthetic agent that the simulated patient has on board. In other words, if an anesthetic agent is delivered and the gas is taking its time paralyzing the patient, the train of 4s utilizing the thumb twitch mechanism is an excellent representation of how well that patient is faring under paralysis, and most importantly, when they start to come out of the paralyzed state. Remember, the thumb twitch mechanism is exactly what happens to a real patient, and it's something that we can simulate on the HPS. Those terminals right built into the wrist of the right-hand side of the simulator are where the train of 4 machine would be attached, exactly what the anesthesiologist would use in the clinical environment to determine the state of paralysis for a patient. Remember, this is very specific to a neuromuscular blockade, or what's commonly known as a paralytic agent. Once the paralytic agent is delivered to the simulator in much the same way it's delivered to a real patient, the simulator will become paralyzed. Its motor movement will become paralyzed. He will stop breathing, his eyes will close, and there will be no response. This is exactly the same thing that happens with real patients. When real patients start to come out of anesthesia, when they start to lighten up, terminology you may hear, when the patient starts to lighten up from paralytics or anesthetic gases, one of the common signs and earliest signs is a thumb twitch when electricity is applied to it. Keep this in mind. something to mention to your customers, particularly the anesthesia crowd, as an appropriate clinical sign of paralysis using medication.